Healthcare goes to you, Senator Hagan. This week marks the one-year anniversary of the Affordable Care Act rollout. And I want to know, has your view changed on that law at all in the past year? And are there any legislative changes you would make in the Affordable Care Act?
Thank you, George. As you said, it has been a year. I think when we look at the Affordable Care Act, I think there are some common sense fixes that need to be made to this bill. As I talk to people all across North Carolina, what they're sharing with me, though, is that they want the politics taken out of this. They don't want to go back to a broken system. They don't want to go back to a time when if you had a pre-existing condition, you were unable to get health insurance. Seniors would be paying more for their prescription drugs, and women would pay more for coverage than they do today. Some of the common sense fixes that I think we ought to be looking at. One, we have taken care of a small business paperwork, a 1099 requirement. The other thing is, I think we need to look at the 30-hour week and versus what is currently in the Affordable Care Act. And the other is to have a copper plan. I think people are familiar with the gold, silver, bronze. We need to look at a copper that would be cheaper and primarily targeted towards young people. But Speaker Tillis would repeal this law and take us back to a broken system.
You know, of course, the Affordable Care Act, the heart of President Obama's legislative program, and Speaker Tillis mentioned the comments the president made last week, and he said his policies are on the ballot, every single one of them. Do you agree?
You know, Speaker Tillis wants to make this race about the president. This race is about who is going to represent North Carolina in the U.S. Senate. And I think North Carolinians want a common sense voice.
Speaker Tillis?
You know, when you vote with the president 96% of the time, you represent the president's policies, the policies that are going to be on the ballot in November. Obamacare is one of the most disastrous regulatory frameworks that have ever been passed in the history of the United States. It's destabilizing health care for 250 million Americans who were satisfied with their plan to try and solve a problem that exists. Of course, we should address issues like pre-existing conditions, letting kids under the age of 26 continue to be on their parents' health plans. But Senator Hagan's broken a promise 24 different times on this issue. Senator Hagan promised the people of North Carolina 24 different times, if you like your doctor, you can keep it. If you like your health care, you can keep it. We know that promise is false because 473,000 people got cancellation notices last year. The president cleverly decided to delay that till next year when the cancellations are going to come out again. And over the last couple of weeks, 50,000 retirees in 11 counties in North Carolina are getting cancellation notices. And what they're going to get on the 15th are premium increases and fewer options. It's a failed policy. It needs to be fixed. It needs to be repealed. And then we need to come up with common sense solutions, not broken promises.
Let me follow up on that, though, Mr. Speaker. How is that going to happen? If you repeal the Affordable Care Act, how are you going to actually be able to come up with policies that care for the children who are 26 and under and for those with pre-existing conditions?
Implement them. I mean, reach across the aisle. Senator Hagan talks about it's time to finally have somebody reach across the aisle and get things done. I believe that there are senators who would actually, Democrat senators who say, you know what, that makes sense. Adding $1 trillion to the debt, which is what Obamacare will do, doesn't make sense. Robbing Medicare of $700 billion over the next 10 years by reducing doctor reimbursements and hospital reimbursements do not make sense. Having a child under the age of 26 on their parents' health plan makes perfect sense. Having a treatment for pre-existing conditions, perfect sense. I believe the American people would embrace it, and they would quickly embrace not having the 2.5 million equivalent jobs lost through this regulatory overreach.
George, I don't think he answered your question again. Let me tell you what he's done to the state of North Carolina. No state exchange, what would certainly help the people in North Carolina. But the other big factor is rejecting Medicaid in our state. 500,000 people in this state unable to receive care. Those people still get sick. What do? They go to the emergency room, which is the most expensive care, and it's not even treatment. That is not right. He could, with a, just like that, could have made that happen. And the other thing, his former company, PricewaterhouseCoopers, has actually written a report that said states that didn't expand Medicaid, their hospitals are suffering. In North Carolina, we've already had one hospital close because of no Medicaid expansion.
You know, we didn't implement a state exchange because we predicted what has happened at the federal level. It was a failure. Everybody knows the stories about the state exchange. It was a failure. You know how much it costs for that website now? $2 billion. We understood that was bait coming to try and advance a failed policy, a policy that's killing 2.5 million equivalent jobs, a policy that's robbing Medicare of $700 billion, breaking a promise to seniors, breaking a promise to people who were happy with their health plans. I'm answering that question, Senator Hagan. I think you need to answer why you told people 24 times if they like their health care, they can keep it, and at what point was that not true, and why did you continue to say it?
Move on to the Supreme